Hello and welcome to this presentation. In this video, I am discussing a series of topics from the previous unit as per the syllabus. So, next topic is binocular vision, normal adult psychophysics. Binocular vision, normal adult psychophysics. These are some of the keys psychophysics of sensory aspect of the binocular vision that contribute to normal adult binocular vision. Visual direction and the horopter. Visual direction refers to the direction of an object in space as perceived by the eyes. The horopter is the imaginary line in space where objects have corresponding point on the two retinas and where visual direction is perceived as single and binocular. The brain uses the horopter to calculate the position of object in space. Binocular fusion. Binocular fusion is the process by which the brain combined the slightly different image from each eye into a single or three-dimensional image. This process relies on the overlap of the visual field of the two eyes as well as correspondence of the image from each eye. Dichopatic stimulation. Dichopatic stimulation is the presentation of the different image to each eye, which can be used to test binocular vision and to diagnose binocular vision disorders. Stereopsis is the perception of depth and 3D structure based on the difference between the image received by each eye. It relies on the brain ability to compare the image from each eye and to calculate the difference in position between corresponding point in the two retinas. Depth perception. Depth perception is the ability to perceive the distance between object and to see the world in three dimensions. It is critical for tasks such as judging the distance to object, catching a ball, and navigating through a complex environment. Integration of motor and sensory system. Binocular vision also rely on the integration of motors and sensory system. The brain must coordinate the movement of the two eyes to maintain binocular alignment and to ensure that the image from each eye remain correspondent. This coordination is controlled by brain team and the visual motor system. Visual direction and horopter. The location of the object physical space is determined by the object direction, which refers to the direction of the object relative to the head, observer head or body. The object direction determines which retina area will be stimulated by the object. In contrast, localization of an object in visual or subject space is determined by its visual direction, which refers to the direction in which the object is perceived by the observer. This is based on the correspondence between the retina image into the two eyes, as well as the processing of visual information in the brain. Experiment demonstration that objects that are widely separate in this physical space may have a common direction in subject space, which suggests that the subject space is not a small projection of physical space. Instead, it is shaped by the anatomical disturbing or retinal element and the physiological distribution of specialized value. Regarding visual direction, when an object is viewed with one eye monocular vision. Its visual direction is represented by the connecting of fovea with the object. This line is known as the principal visual line of axis. Each point on this line can have its own visual axis. So, for a given eye position, objects which superimpose retinal image will be seen in a line but a different distance. Binocular. The binocular vision, the frame to reference for visual direction, is the head, or more specifically the point between the eyes. This is known as the recognitive frame or reference. The visual space is perceived as if seen through a imaginary single eye at the point between the eyes and has its own visual axis. Hearing law of identically visual direction state that corresponding point on the retina of the each have the same visual direction. Corresponding points are those that are in the same location in the visual space, but on different retinas. The fovea, which are the central area of the retina with the highest visual acuity, have a common subjective visual direction, which means the object that fall on corresponding point of the fovea will be perceived as being in the same direction in visual space. This law is important for binocular fusion as it ensures that the image from each eye are correctly aligned in visual space. Without this alignment, double vision or other visual distortion can occur. Horopter. The horopter refers to the locus of the all object point that are imaged on corresponding retinal element at a given fixation distance. In other words, it is the set of point in space that, when fixed on, field on corresponding point on the two retinas. The horopter is different from each fixation distance as the relationship between the image on the two retinas changes with change in distance. The concept of the horopter was introduced by the mathematician Francian in 1613 and later approved mathematical by the German physiologist Hermann von Helmholtz. The term horopter comes from the Greek word horos, means boundary or limit, and opter meaning to see. Horopter curve. The circle is a theoretical or mathematical curve that describes the longitudinal horopter when corresponding points have a regular horizontal distance from the two retinas. It passes through the central or rotational of the two eyes and the fixation point. However, empirical studies by Hearing and Hildebrand Slowing showed that the Muller circle does not accurately describe the longitudinal horopter in the practice. The empirical horopter curve is flatter than the Muller circle and has a more complex shape. Binocular fusion. Binocular fusion refers to the integration of the slightly different image from the two eyes into a single three-dimensional perceptual experience. When the image of an object falls on the corresponding retinal point, they seem to fuse into a single mental impression. Sensory fusion is the perceptual experience of the fusion image, while motor fusion refers to the ability of the eye to align in a way that maintains sensory fusion. Retinal disparity, which is the difference between the image formed on the two retinas, is this simultaneous for those functional eye movement. More fusion is an automatic process that is mediated by the Burgess systems, which control the position of the eye relative to each other. The Burgess system uses information from the extrafoveal retinal periphery to the aligned eye, maintain bilocular fusion. Penum's area. Penum's area, also known as the fusional area, refers to the regional in visual space over which we perceive signals visually. Objects within this area are fused into a single perceptual experience, while objects outside of this area are perceived as double. Penum's area is not a fixed region and can vary depending on factors such as the size and shape of the object, the distance of the object, and the size of the retinal disparity. Ogles and Cowards coined this term. Ogles and Cowards coined the terms Penum's area to refer to this region in visual space where object can be seen within single fusion visions. Fiction's disparity. Next topic. Fiction disparity refers to the small binocular misalignment that can occur even when fusion is maintained. It is a normal variant of binocular vision and occurs within Penum's fusional area. Fiction's disparity can be used to measure the AC by A ratio, which is the ratio of accommodative convergence to the accommodation. Male development of binocular visions. Male development of binocular single visions can lead to a variety of visual deficits, includes amblyopia, strabismus, and other binocular vision disorder. The brain relies on early visual experience to establish normal binocular vision, and if eye aligned is delayed or not achieved, the visual system can become permanently disrupted. This can lead to a deficit in binocular responsiveness and reduced sensitivity to visual disparities, as well as a range of other visual impairment. Overall, the development of normal binocular vision is essential for the brain to properly process visual information and navigate the visual world. Strabismus. Strabismus is a condition in which the eye do not line up properly, leading to misaligned eyes. It can affect one or both eyes, and it is usually caused by a problem within muscles that control eye movement or the nerve that transmitted signals to those muscles. Esotropia refers to inward turning of one or both eyes, while exotropia refers to the outward turning of one or both eyes. Hypertropia is upward turning of one eye, and hypertropia is downward turning of one eye. Strabismus can cause a range of problems including double vision, loss of depth perception, and eye strain. It can also affect a person's ability to read, drive, and perform other everyday tasks. Treatment options for strabismus includes glasses, eye patches, vision therapy, and surgery depending on the condition. Those are some of the common causes of strabismus. As you mentioned, it can result from a problem with the neuromuscular control of the eye movement, which can be caused by variety of underlying condition. Refractive error such as nearsightedness or farsightedness can cause strabismus if they are not corrected with glasses or contact lenses. Poor vision in one eye, also known as amblyopia, can also lead to strabismus. Congenital disease such as hydrocephalus or cerebellum palsy can cause strabismus. In some cases, the brain tumor, stroke, and head injury can also damage the nerves or muscles responsible for eye movement, leading to strabismus. Neurological problems such as myasthenia gravis or multiple sclerosis can affect the muscles that control eye movement, leading to strabismus. Graves' disease, which is caused by an overproduct of thyroid hormone, can also cause eye muscles problems that lead to strabismus. It is important to identify and treat that underlying cause of strabismus, as it can have significant effect on a person's vision and quality of life. Classification of squint, also known as strabismus, is a condition in which the eyes do not align properly. There are several types of squint based on their appearance of onset. First appearance squints. This type of squint is noticed by parents or caregivers when the child is very young, usually within the first few months of life. Number 2. Latent squint. A latent squint is not apparent when both eyes are open but become visible when one eye is covered. It can cause double vision and eye strain. Number 3. Manifest squint. A manifest squint is visible when both eyes are open. It can cause problem with depth perception, eye strain, and self-esteem. Number 4. Concomitant squint. A concomitant squint is a type of manifest squint where the angle of deviation remains constant in all directions of gaze. Number 5. Paralytic squint. A paralytic squint is a type of manifest squint caused by a weakness in one or more of the muscles that control the eye movement. Number 6. Intermediate squint. An intermediate squint is a type of manifest squint that occurs only at certain times, such as when the person is tired or looking at something far away. Number 7. Concomitant squint. A concomitant squint is a type of squint where the angle of deviation is constant in all field of gaze. Number 8. Inconvenient squint. An inconvenient squint is a type of squint where the angle of deviation varies with the direction of gaze. Number 9. Divergent squint. A divergent squint is a type of squint where the eye deviates outward. Number 10. Convergent squint. A convergent squint is a type of squint where the eyes deviated inward. Amblyopia. Amblyopia, also known as lazy eye, is a condition where the brain and the eye do not work together properly. It is a result of a disruption in the normal visual development process during childhood. The condition typically affected only one eye, but some cases both eyes can be affected. Amblyopia is not caused by any structural abnormality in the eye, but it results from the brain ignoring the visual input from one eye. The most common causes of amblyopia are strabismus, misalignment of eye, and refractive error such as nearsightedness, farsightedness, or astigmatism. If one eye has a significant refractive error or the eye are misaligned, the brain will receive different image from each eye, causing confusion in the visual system. As a result, the brain will start ignoring the visual inputs from one eye, leading to a reduction in the visual acuity in that eye. The diagnosis of amblyopia is typically made during childhood, and early detection is essential for some successful treatment. The treatment of amblyopia may be include correcting any underlying refractive error with glass or contact lens, patching the better seeing eyes, or using eye drop to blur the vision in the better seeing eyes. These treatments aim to force the brain to use the weaker eye and promote the development of the visual pathway. In some cases, this surgery may be required to correct misalignment eyes. The early the treatment is started, the better the chances of success in improving the vision in the affected eye. Without proper treatment, the amblyopia can lead to be permanent visual impairment in the affected eye. Therefore, it is crucial to have regular eye exam, especially during childhood, to detect any potential eye condition, including amblyopia. Classification. The classification of amblyopia includes the following types. Number 1. Unilateral amblyopia. This type of amblyopia affected only one eye and is the most common form of amblyopia. Number 2. Bilateral amblyopia. This type of amblyopia affected both eyes and is less common than unilateral amblyopia. Number 3. Strabismic amblyopia. This type of amblyopia occurs as a result of strabismus, which is a misalignment of the eyes. In this type of amblyopia, the brain ignores the input from one eye to avoid seeing double. Number 4. Refractive amblyopia. This type of amblyopia occurs as a result of significant refractive error, such as nearsightedness, farsightedness, or astigmatism, that are not corrected early in life. In this type of amblyopia, the brain ignored the input from the blurry eye, leading to a reducing in visual acuity. Number 5. Deprivation amblyopia. This type of amblyopia occurs when there is an obstruction and deprivation of vision in one eye due to a congenital cataract, corneal opacities, or other ocular abnormalities. Number 6. Mixed amblyopia. This type of amblyopia occurs when a combination of a strabismus and significant refractive error are present in the same eye. The treatment of amblyopia depends on the underlying cause and severity of the condition. Early detection and treatment can lead to significant improvement in visual acuity and long-term visual outcome. Treatment of amblyopia. Provided a comprehensive list of treatment options for amblyopia, which are as follows. Number 1. Spectacle correction. This involves prescribing glasses or contact lens to correct refractive error that contribute to amblyopia. Number 2. Occlusion therapy. This is the most commonly used method to treated amblyopia, where the better seeing eye is occluded to force the amblyopic eye to work harder. Occlusion can be total or partial and usually last for several hours a day. Number 3, cycloplegia. This involves the use of cycloplegic drugs to blur the vision in the better seeing eye, thereby giving the amblyopic eye more stimulus. Number 4, optical penalization. This treatment involved including the form vision of the non-amblyopic eye by alternating the spectacle correction. This encouragement the amblyopic eye to work harder. Number 5, pleoptic therapy. This method usually monocular techniques for the detection and elimination of eccentric fixation and amblyopia. Number 6, surgery. This is used to correct strabismus, which can be a cause of amblyopia. The choice of treatment depend on the underlying cause of the amblyopia and the severity of the conditions. A conditions of treatment may be required to achieve the best possible visions or visual outcome. It is essential to start treatment early in childhood to achieve optimal result. Binocular vision in other animals. Binocular vision is not limited to humans and some other primates. Many animals also possess binocular vision, and the degrees to the which they have it can vary depending on their needs and lifestyle. Predatory animals such as cats, dogs, and owls tend to have forward-facing eyes that allow for binocular vision. This helps them judge distance accurately and make precise movement when hunting time. The eyes of those animals are often placed close together, which helps to increase the degree of overlap in their field of view. Some of other animals, such as horses, have a more limited degree of binocular vision. Their eyes are located on the side of their head, providing a wider field of view. However, they still have a certain degree of binocular vision, which allow them to see some depth of distance. Birds are also known for their remarkable visions, which allow them to negative and hunting in flight. Many birds have eyes that they are placed on the side of their hand, gives them extremely wide field of view. Some birds such as owls and eagles have forward-facing eyes that allow for binocular vision, which is useful for hunting and tracking time. Overall, the type and degree of binocular vision that an animal possesses depend on their etiological need and the specific demand of their lifestyle. So thank you for all joining me and all for your time and attention. I hope you found this presentation informative and engaging. Thank you again.